Joanna. So we're going to welcome Joanna, who is a member of the French Society of Allergology, and she's going to present the Allergen Chip Challenge. Yes, good afternoon. Thank you for the invitation. Thank you for this project, because Health Data Hub has been supporting us now for a year, because our deadline was 28th of May last year, and we hit that. So I'm an immunologist by training. I'm an allergologist for about 20 years. Allergology is the best way to produce clinical verification models of immunological verifications, according to my colleague. And this is a challenge that is quite similar to what we've seen since the beginning of the afternoon. And so we are the Society of Allergologists in France. And we work with the INSERM Society, the Institute of Breast for Epidemiological Data from the University of Montpellier, and also the Hospital Association focused on allergology. So our context is that we live in a world of allergens. This is not just a concept, but a reality. We are constantly surrounded by allergens, whether it's pollen, whether it's food, whether it's mold, through air conditioning or other means of exposure. And these allergens are handled in different ways by immune systems. And what happens for some cases is that there is a loss of tolerance of this particular antigen. So when we lose tolerance of a particular allergen, an allergen is an antigen that causes an allergic disease by inducing an adaptive immune response. So this adaptive response is based on immunoglobulin E, which is linked to an immediate allergic immune response. So in allergology, one of the good things that we have, as opposed to what we've heard since the beginning of this afternoon, is that we have a clear system for diagnosing our patients. We need a clinical history and a demonstration of an IgE response to an allergen. Since allergens are virtually unlimited in their range and variety, there is an almost infinite variety of IgE responses, and we're currently putting this variety into a nomenclature, which is a website. We have a website of allergen nomenclature where we have currently 1,000 molecules that have been approved and recognized, but there are tens of thousands that still need to be added to this database. So in terms of allergens, if we look at a molecular level, one of the excellent things that some of these are specific to the allergen source that they come from, and others are linked to others. So for example, you have latex here with two specific modules that create a response to latex only. So this is the link to some anaphylactic responses to some latex products. And then there are also a whole range of other allergens with a mixed response that will make you react to fruit or pollen or to the leaves of your plant in your office, or to different types of mold. So you can have 1, 2, 5, or all of these different groups of allergens, and therefore respond only when you're on the operating table or in some other context, or each time that you meet one of these groups of molecules. So the way that you respond is linked to these IgEs. The quantity and concentration of IgEs, we have information about that, about their specificity, and also clusters. So we already have data for allergology, which helps us to understand the severity of an allergic response linked to the presence and the quantity of the adaptive allergic response. And then now for a number of years, we are also starting to use what we call clusters. And we are already, sorry, just struggling with my PowerPoint here. We are already available, are able to use more developed diagnosis tools. So currently in allergology, we have access to big data, which is really quite remarkable already. As you can see, if we have a patient, for example, a child of 12 who's reacted to peanuts and soybeans before she was allergic to egg, but now tolerates it and also responds to olive pollen and has asthma. So you can see on the left of the slide here, we can do a biological analysis with up to 300 different allergens, food allergens, etc. And there's all these questions that we can ask, whether this patient needs to have an adrenaline auto-injector, a self-injector. Can this child eat cashew nuts? Can this child go and share food with friends, or is that going to risk their life? Is the patient able to interact with dogs or not? Whether the family dog should be banned from the sofa? So we can therefore go further, and what we want to do is go further with this data, and that's why we've developed Allergen Chip Challenge, so that rather than having this way we work on the left, where this patient goes to see an allergologist who does different sets of analyses and examinations, which will then be seen by the biologist, who will then think about the situation and will talk again with the allergologist, who will then speak with the patient. And so we have this kind of very inefficient loop effect and toing and froing. And as we heard earlier, we need expertise that goes beyond the capacities of a single individual. So with the Allergen Chip Challenge, what we want, look, I've got a pointer here, is to develop a single circuit where we have the patient, the allergologist, the biological analyses, we have an algorithm, and with this algorithm, it works well for everybody, and we can share all the information, and this serves other patients, and it doesn't remain just something that's individualized off in the corner of an office, but it's something that's shared. So here's a very brief presentation of the project as we understand it for the moment. So we started last year. We have been working since September, when we heard that we'd been received pre-acceptance. And like everyone else in this room, I think we received the final acceptance at the end of April and funding just a few days ago. So we're going to focus on the exploration of allergen multiplex investigation. We have hundreds of digital data items for each patient, and we want to make them easily usable by allergists. And using artificial intelligence, what we want to do is, as we saw earlier with the Epithor register, for example, we have collections of biological and clinical data for the last 10 or 12 years. But unlike the national registries that we saw earlier, we have never centralized these. So what we want to do is that through this project, bring together all the databases from the 10, 12, or 15 university hospitals that are working on this area, as I presented to you at the beginning. And through this partnership, through the French Society of Allergology, which is the lead investigator, we want to provide data for 3,000 patients that has data that's been annotated. Once again, this is different from what we've heard at the beginning of the afternoon. We know what the patient situation is. We have the clinical data and the biological data, and what we want to be able to do is to predict from this data. Of course, what we're hoping for is to succeed at the end in developing a database, an open science database, and also an open source algorithm. Since we've already identified some of the problems. So my key messages are that this data challenge is a hot topic for allergology. We need to use the tools that we already have to help us understand how the environment impacts allergology. And it's also a hot topic for the competitors because as opposed to all the other data challenges we've already heard from, we have digital data which can be provided on an Excel sheet, and you will be able to get involved in the adaptive immune response, which is an infinite aspect, which is fascinating. And of course, there will be a small prize for the data challenge winner. There's 25,000 euros. I think this is the general prize value that's been chosen for this set of challenges. I hope there will be a number of competitors. I hope that you are interested in this data challenge. This data challenge is really going to change the life of allergologists and allergic patients. And some of you may well be allergic yourself. Thank you very much. We're now going to take a few questions. Are there any questions here in the room? I think there's a question at the back there. Thank you very much for this presentation. There's a lot of information. One thing I'm not sure I understood is geographical data included in the data in terms of the location of patients? Yes, this data is included. In terms of the example I gave, I talked about olive pollen. You don't see that in Paris, but I deliberately included that, and we have that geographical information. Of course, we will code this information so that the region and department, the French local area, is not listed, but we have that information. We have a question online. What is the criterion for the success of the algorithm? Since we are immunologists and allergologists, we are complicated. So there's a number of actually answers to that question. First of all, is the patient whose result you are seeing, is the patient allergic or not? If the patient is allergic, is the allergy a food allergy? Is it a respiratory allergy? And what level of severity? Through a number of gradings. And for the moment, we've focused on collecting data so we have something that's uniform, but the precise criterion for the success of the algorithm will be defined in the coming weeks and months. Thank you very much. We have another question online. Is it possible to clearly specify what we're looking to predict, whether the patient is allergic and what to, for example? Yes, of course. When you look at the biological results of a patient, there may be a biological response, for example, with regard to peanuts or pistachios and dogs, and a number of molecules may be involved here. And then there may be different intensity levels, and then combinations can vary. Depending on this, we have a few ideas as specialists, but what we want is to see an algorithm developed by you competitors that would help us to move away from personal bias. Another question we've just had in English.
Set of tests allowing to collect comprehensive standard data for each patient.
Standard tests for collecting comprehensive data. standard tests for collecting comprehensive data, I'm not sure, but standard tests, yes, because our immunology investigation of allergic patients is standardized. If there is something that is standardized in medicine, that's for sure laboratory medicine.
Thank you.
Oui, bonjour, merci beaucoup pour cette proposition de data challenge très intéressante.
Yes, thank you very much for this very interesting data challenge proposal. I think here there's going to be data for 3,000 patients from 10 or 15 different university hospitals. I imagine that's not a high number of patients in terms of all the patients available. How are you going to develop this sample? In a very pragmatic perspective, given that we have 1.5 year timeline for this data challenge, is that it's going to be a retrospective approach. So it's going to be 3,000 patients representing about 30 to 50% of the data that we already have in our databases. I guess I wanted to know a little bit about the profiles of patients as well. So that's half the patients that are available. Are we mainly focused on severely allergic patients or those who have a number of questions we're trying to deal with? So those that we don't yet have the details for will be those that we don't have clinical data for, and we can't yet annotate them from a biological perspective. Then, of course, patients that were tested in 2010, 2011 with an allergic tag, there will be an evaluation of the severity and of the different cases. But since then, this has become much more popular and widespread, and there are a number of hospitals where this test was open and freely available to all. We have sampling that is representative of the patients, perhaps not seen by the GP, but seen by the hospital allergologist, particularly because there is a torsion, as it were, for allergologist patients. They are often seen by local allergologists before being sent into hospitals. And so these patients are then analyzed, and the analyses are carried out in the hospital laboratories. Thank you very much, Joanna.